We have Dr. Bruce Dart with the Tulsa County Health Department with us. He's the executive director. Dr. Dart, can you please tell us how are things going right now? It's March 26th. Obviously, everything is going to change in a few hours and the next day, but give us an overall look.
Well, thank you, and thank you for having me on today. As we've all heard information, I think, about what coronavirus or COVID-19 is doing to the world and this country, and to Oklahoma and to Tulsa. And so we are continuing with all of our partners, and this has very much been a collective, collaborative community response to COVID-19 here in Tulsa and Tulsa County. Working very closely with our healthcare systems and our Tulsa area emergency management and public safety to assure that we have the ability to protect people as much as we possibly can. And in lieu of a situation where we have a virus with no vaccine or medical therapies to fight it.
I noticed just today or from yesterday, the numbers almost doubled in some cases. Are you expecting this to gradually go, or will exponentially increase, do you think?
All these things, all these restrictions are really being done to do what we call flatten the curve, which I'm sure everyone's heard that expression. But the more positive results we get, the curve goes up. And if we can break that chain of transmission, stop people from coming together, we can flatten that curve, and that curve can go down. So we're just really in the very beginning of stopping public gatherings, stopping people from coming together. And so hopefully in the next few weeks, we'll start to see a decrease and a flattening of that curve.
And in the next few weeks, once we start to see the flattening of the curve, everybody's want to go back to normal, but really we're still going to have to do a lot of precautions, aren't we?
Yes, we are. And I think we all need to hopefully embrace the fact that we're in this for a while. And there's no magic number. There's no special sauce that says if we do this thing, we're going to be able to do that in response down the road. So we really have to pay attention to the data and to what the environment is telling us.
So far, do you feel like Tulsans are doing enough to keep up with this? In that they're doing the right thing?
We need everyone to step up. I mean, we're all in this together, and frankly, we need everyone to embrace coming together to stay apart. And if we can do this, the pain that we're feeling now will be temporary, won't be near as bad as the pain we'll have in the future if this ramps up and we become so overwhelmed that as a healthcare, as a city, as a county, as a society, we can't function. And that might sound dramatic, but that's just the reality of the situation we're in.
Well, thank you very much for your time today, Dr. Dart.
Appreciate your time today as well.